Good morning, friends. I'm Dr. Anu. I'm a neurophysiotherapist, and today I'm going to show you a few exercises which are very important for your lung rehabilitation. I know we all are going through tough time, and when the country is facing this second wave of COVID pandemic, importance of breathing exercises is something everybody's realizing. So the exercise that I'm going to display you today is very important in improving the oxygen saturation levels in your blood. So in case you're feeling any of the difficulties in breathing, or anyone near you in your family member is suffering from COVID symptoms and having any congestion in lungs or breathing difficulties, doing this exercise will ensure proper oxygenation level in your lungs. So basically what happens in breathing exercises, see, our lungs have majorly three lobes: upper lobe, middle lobe and lower lobes. So in the upper lobes, definitely since it's on the upper side and we are mostly sitting, the ventilation, the oxygenation is happening properly. It's majorly the lower lobes, and the side lobes which are affected. But majority of the people, these days our posture is very poor. Like most of the times we are stooping forward in doing the work, right? I'm sitting in this position just to make you realize. Just imagine if I'm sitting like this, what will be the position of the upper lobe, of my lungs? They are kind of squeezed, compressed. And imagine if I'm doing opposite of that and stretching it like this, the space, the surface area actually, of the internal upper lobe of the lung gets widened up, right? Opened up, and it allows for more mixing of oxygen in the blood, so more oxygenation will happen and the blood levels of oxygen will start to improvise, right? So there's one more important exercise that I'm going to display. What you have to do is sit in any position and open your legs as wide as you can and place your hands on the opposite sides like this, right? So you have to cross the arm and hold the opposite side of leg like this, and then stretch, open your legs like this as much as you can. So now when you're doing this, you will feel a burning sensation around this segment of your shoulder blades, between the shoulder blades. And this is how you have to do: open as much as you can and then bend forward like this. So now I'm really feeling a burning sensation between my shoulder blades on the upper side of the lobe, and actually this is stretching my upper middle lung lobe tissue like this. Hold it for like a couple of seconds and then you can come back. Now after you do this, you will realize a sudden increase in the oxygen levels, because we are actually utilizing the area which is not mostly compressed. This is a proven exercise and will definitely help your loved ones to improvise on the symptoms that they are facing, because actually what happens is the virus is affecting us more in the pulmonary segment, right? I mean, it's not that harmful in case we are it's just there in the throat and it's gone, because we can definitely work it upon with the hot water gargles and other features. But if it is impacting the lung tissue, that is where the life-threatening conditions might happen, because of course if the oxygen levels start to drop down, body's vital functions will stop functioning properly, and that might prove fatal. So make sure that doing breathing exercises is something which we all can do at home. It doesn't require any hospitalization, and if you're able to manage it with a good lung capacity, definitely it will be a added advantage, and it will prevent any sort of hospitalization. Also, one very important thing: anybody doing smoking, please stop it immediately, because it's definitely going to make you more prone to, in case you develop COVID, it'll make you prone to develop complications, because your lungs are not really healthy. The tar accumulation happens because of smoking. So that's one piece of advice I would like to give everybody. And another exercises I'll come up in next video. Please stay tuned. I'll try to give you as much information as possible about correct posture. One more thing I want to add up in this video is, if somebody is really facing difficulty, try lying prone, because if somebody is lying on your back like this, the lowermost segments of the lungs, they do not get sufficient oxygenation levels, right? Because the oxygen permeation is not happening there. So when you lie on your tummy, like prone lying is lying on the tummy, so lie on your bed with your your tummy the chest downwards, and you can place one pillow beneath this like this. I have to lie, I can lie like this, of course properly on the bed. And in this position, if you can hold it for like 15-20 minutes, and then you can check the oxygen levels after that, you will realize it is really significantly improved. So that's all for now. I'll come up again in the next video. Till then, stay safe, stay indoors, stay healthy, and I wish you speedy recovery.